If you've owned a horse long enough, you've probably either already dealt with colic, or if you stick it out, you very likely will in the future. The most dangerous thing about colic is not actually the pain, it's how easy it is to convince yourself that it's probably nothing. You know, horses get hurt, horses act off. Today, I'm breaking down what colic actually is, what people usually miss, and when you need to stop waiting and call the vet. So let's talk about it. What do people notice first? Most cases of colic don't start off with violent thrashing, dramatic rolling. In fact, what I hear most often is that their horse just seemed a little off one day. Maybe your horse doesn't finish their grain, or maybe they're standing away from the herd. Maybe they're pawing once in a while, occasionally looking at their side, and laying around more than usual. Those subtle signs matter. Colic pain often starts mild and it escalates fast. Let's talk about what horse owners assume and why that's a problem. A lot of horse owners, when they first notice that their horse is acting a little bit off, they brush it off. They say, oh, you know, she's probably a little bit gassy. He just does that sometimes. Or, give it an hour, and then I'll check back. And yes, sometimes it is just a case of mild gas colic. But here's the problem. You cannot tell which type of colic your horse has simply by looking at them or by observing their behavior. A mild looking horse that looks like it's just having a one-off day can still have a very serious surgical problem developing. So what actually is colic? In simple terms, colic is not a disease, but a symptom. It just means abdominal pain. Now, the pain can be caused by a few different things like gas buildup, feed or sand impaction, intestinal spasms, intestinal twists, displacements, or strangulations where it twists so that there's no oxygen getting delivered to either part. If you envision a loaf of bread with the little twist top, strangulation. Now, some of these do resolve with very minimal treatment. Others are life-threatening and time-sensitive. Unfortunately, pain level does not dictate severity. So you can't always go based off of how painful or not painful your horse appears. Frequently, pain level matches severity, but not always. So what do vets actually do when a horse is thought to have colic? When a vet evaluates a colicky horse, they're looking for a few different things. They will be listening for a heart rate. A lot of times if a horse truly does have a form of colic, their heart rate is escalated, usually because they're in pain. They'll listen for gut sounds. In horses, it's very normal for there to be near constant gut noises. So a quiet gut is bad news, and it means that things are not progressing through the gastrointestinal tract as they should. They're also looking at mucous membrane color to check for tissue perfusion. In simple terms, that's just how quickly blood fill up the tissue spaces once pressure has been applied and then released. So they'll do what's called capillary refill time, where they'll take a finger and lift up the horse's gum and just press firmly on the gum to blanch it, and then count how long it takes for the blood to return back to the tissues. If it's prolonged, which is anything greater than 2 seconds, we have a problem. They'll also be looking for signs that the horse is in pain, if they're squinting their eyes, gritting their teeth, for example. Vets will also do rectal examinations to see what they can palpate in the horse's hind end. Sometimes they'll have to perform an abdominal ultrasound on your horse or tube your horse's stomach. Now, all of these bits and pieces of the examination help the vet to determine if they're dealing with something medical, if it's something that requires surgical intervention. And this is why early intervention matters, because the sooner and earlier the vet can evaluate your horse, the more options there usually are. How do you know when to call the vet? Because nobody wants to overreact, but you don't want to underreact either. So this is perhaps the most important part of today's video. You should call your horse vet immediately if you see any of these signs. If your horse is repeatedly laying down and getting back up again, call your vet. This will frequently be accompanied by your horse rolling or attempting to roll repeatedly. When a horse displays these behaviors, they are experiencing severe abdominal pain and they are attempting to relieve it by assuming different positions. If you notice your horse is sweating without exercise, excessive sweating is a sign of severe pain. If your horse is pawing the ground persistently, call your vet. Sometimes, if you have mild pain relief and you administer it to your horse and it doesn't seem effective, you need to escalate the situation and get the vet out to see your horse. Sometimes the pain medication provides temporary pain relief, but as soon as that medication has worn off, the horse starts to become painful again. If this happens to you, call your vet. And here's my professional advice. If you're debating whether or not it's worth calling the vet, it is worth calling your vet. Veterinarians would much rather be early for a mild colic than late for a severe one, because at that point your options are limited. I want to reassure everybody out there that most cases of colic are mild. In fact, most cases of colic are thought to happen without the owners ever being aware that their horse is having a colic episode. So rest assured, most colic cases are treatable, especially when caught early. And being cautious doesn't make you dramatic. It makes you a good horse owner. So don't let how you think others may perceive you as being dramatic as being a reason why you don't intervene and get immediate attention for your horse. If you want more horse videos breaking down common horse health issues in plain language, subscribe. And if you've ever dealt with colic, let me know in the comments. What signs did your horse show first? So let's say a horse does have colic. What are the treatment options? Treatment depends entirely on the cause of the colic. So the most common form of colic is, thankfully, just gas colic. Gas colic is usually mild. This happens when gas builds up in the intestines, causing stretching and discomfort. This type is often linked to dietary changes, environmental changes, or just plain old stress. If this is the case, usually you're looking at pain control, antispasmodic support, possible tubing to relieve the gas, and monitoring to ensure response to treatment. Oftentimes, gas colic resolves quickly, and the horse improves noticeably within hours. Gas colic can look mild. More severe forms of colic, like impaction colic, can also look mild as well. So let's talk about the more serious, the more dreaded type of colic, impaction colic. A lot of times the impaction is either from feed or sand. When this happens, the intestines are physically blocked and food cannot go past a certain point. This is common with dehydration, poor feed quality, or sand ingestion. That's why it's so important to not just throw your horse's food down on the ground if there's sand in the area. Now, if your horse is suffering from impaction colic, this means pain control, fluids given usually IV, even orally, frequent and repeated assessments to determine if the horse is recovering or worsening, and very frequently, multiple days of treatments, even hospital stay. Many of these forms of colic are resolved medically. However, if not caught soon enough, sometimes the horse will worsen. But just remember, impactions don't usually resolve instantly. It is a slow, gradual process to recovery, which is why monitoring matters so much. Another type of colic is spasmodic colic, When this happens, the intestines of the horse are spasming, which causes the horse pain that comes in waves. This is usually stress related. Perhaps your horse's one and only pasture buddy of 20 years passes away. Your horse could potentially become stressed to the point where they get spasmodic colic. The typical veterinarian approach is, you guessed it, pain control. Sometimes muscle relaxers are used, and of course, observation for reoccurrence. Horses with spasmodic colic often improve quickly, but recurrence is possible. Worth noting that improvement doesn't mean the problem is gone forever, just that the horse in that snapshot in time is getting better. But continued monitoring until your horse is completely out of the woods is important. There's also displacement colic. This happens when intestines shift in position and the intestines have moved where they shouldn't. When this happens, blood flow can be severely restricted to the intestines and therefore deprived of oxygen as well. The typical approach when this happens is initially aggressive medical management and the close monitoring of pain and vitals. If the pain persists or worsens, often your horse has to go get referred out somewhere for further diagnostics. Some of these colic cases resolve medically. Others progress to needing surgical intervention. Pain that doesn't stay controlled is a red flag. Another type of colic in the horse is strangulating and twisting lesions. If this is happening, it is a true emergency. So what's happening is blood supply to the intestines has been cut off. Imagine a loaf of bread with the twist top. Essentially, in this sort of colic, that's what's happening to the horse's intestine. And the tissue quickly begins to die off because there's no blood supply and therefore no oxygen to that intestinal tissue. In cases such as this, surgery is typically the only option, and it involves intense aftercare. A lot of times your horse will be at the hospital for several days following the procedure. As you can probably guess, this is a very time-sensitive form of colic. Intervention has to happen ASAP. The longer treatment is delayed, the more damage that is rendered onto the intestinal tissues, and the prognosis for that horse worsens. Remember, no amount of medication can fix a strangulating colic. There's also enteritis, which is inflammation colic. When this happens, the intestines become inflamed. Often, if this is the case, the horse will also have a fever, diarrhea, or some sort of systemic illness. This usually requires hospitalizations, fluid therapy, pain management, of course, and supportive care. This kind of colic can be serious and requires aggressive medical management. So let's say you've called the veterinarian and you're waiting for them to come to you and your horse. What should you do in the meantime? First and foremost, remove your horse's feed. If there's a blockage in the intestine, food is only going to worsen the problem. Prevent your horse from rolling if possible, because you can potentially get the intestines twisting and strangulating even more than they might already be. Your horse starting to sweat. Is their heart rate escalating? Do they have a fever? Monitor their signs so that you can let the vet know, hey, it's getting worse. It's been 30 minutes since I called you. This is what's happening. Or you can let the vet know, hey, my horse is doing about the same as when I called you. This provides your vet with vital clues as to what type of colic, if it is colic, that your horse might be experiencing. Let's go over some important things not to do while waiting for your vet's arrival. Don't give your horse leftover medications without your veterinarian's direct approval. Pain control can mask symptoms therefore masking the severity. If your horse is in severe pain and can't get up, don't insist on them getting up and walking. If your horse is that poorly off, they can't handle the movement. They can't handle walking about. So let your horse be. It can be tempting to look at your horse displaying certain symptoms and say, oh, you know, my horse did that last summer and they got better. It is always better to overreact than underreact. Please note this video is for educational purposes only and is not a substitute for veterinary care. If your horse is colicking or you suspect it may be colicking, always contact your veterinarian promptly. To all the horse owners out there, you got this. And I'll see you next week for another horse video. Bye for now.